So this morning we want to introduce you to the idea of functional neurology. And here to give us those details and let us know if it might be the right fit for us is Dr. Zach Walker. Thanks for joining us.
Thank you for having me.
All right, so tell me a little bit about what exactly is functional neurology.
So functional neurology, I am a chiropractor as well. So I've done the traditional chiropractic, schooling, if you will. But the functional neurology is another 4.5-year specialty.
Okay.
So it's after all that's done, it's another 4.5-year specialty. And it basically allows me to see patients that have your traditional neck pain, back pain, but also that have dizziness, that have headaches, that have concussions. And even when we say dizziness, it's your traditional, as I'm walking, I feel off balance, but also, when I'm reading, I feel I'm off balance, or I feel, brain fog. When I'm going up and down elevators or escalators, I just kind of feel like I'm losing my balance. So it's those things that you wouldn't also think of as, balance. It's also associated with that. So what functional neurology is kind of, it's your traditional neurology if you were to go to an MD, a lot of those same tests, but it's really how does that affect your everyday life. So some of the tests we're doing are the same, but it's really how is your balance, how is a concussion, how is that affecting your everyday life, and what are some treatment options we can do to help that essentially.
And so the idea of functional neurology along with the chiropractic side really ties together in many ways.
Absolutely it does. They absolutely go hand in hand. So the chiropractic, if you've ever been, we do a lot with manipulation, or what we call adjustments. Before we do that, we want to make sure that your nervous system is working, appropriately. We kind of heard the old adage of practice makes perfect. Well, it should be practice makes perfect, permanent. So if I'm going, shooting a free throw, 50 different times, 49 times I am shooting it wrong, it's not like that 50th time it's going to be all of a sudden better. So it's really, that adjustment, whatever that modality is, could be perfect for you, but maybe not in that certain situation.
Right, makes perfect
sense.
So
before, we do the chiropractic, we want to make sure that all the systems of the body are working, appropriately. So whatever we can do to help with that, it's just, helps with that, essentially.
Okay, and so you mentioned that this is going to be your great fix or remedy for maybe some balance issues or concussion issues, something you typically wouldn't think to go see a chiropractor for.
Absolutely. So it's, especially when we start talking about balance, concussions, or even headaches, those are the kind of the three big that we see kind of in the office. There's absolutely a neurological component to that. So concussion's really big right now. And the return to play is a big thing. Does the athlete return to play 2 weeks, 3 weeks, whatever the case is?
It's a big debate.
Absolutely, it really is. And with concussions, it kind of all depends. There's kind of a big push now for not returning back to play, within a week or two, just because it takes a week or two for you to even start kind of healing. So we go in, no matter what patient we're having, whether it's your traditional neck pain, back pain, or concussion, or dizziness, everyone goes through a full neurological evaluation. So that's looking at every aspect of you as a person, individually as well as comprehensively, and seeing how they're working together or not working. Putting in a care plan specifically for that patient, and then implementing that. Because with concussion, it can be 10 different patients that have concussion, but they're all going to respond differently. Your body's going to respond differently to that concussion. So we want to make sure that that's really specific for that patient. So it's really going to help them, especially long term.
And it's really a customizable approach. So talk to me a little bit about some of the treatment options.
So with the treatment, it's still the chiropractic, so we're not doing any type of, it's all non-invasive. So we're doing different, I could kind of say eye movement therapies or balance stuff, and it's kind of, how would that help me with my concussion? So, and it's basically, with a concussion, you have the brain itself as well as the lower brain stem, and that brain stem is helping us breathing. It helps us, concentrate. When I have a concussion, it really twists, kind of like you're twisting a towel. If it twists, it's going to affect all those different systems. So we want to make sure that we're going in, making sure eye movements are good, making sure that your balance is good, because those are going to be affected, as opposed to just making sure that, you're feeling better. Because we want to make sure you're feeling better, but also making sure that this isn't going to happen again and again.
Right, that we're trying to prevent it and fix what was done.
Absolutely.
So the chiropractic neurology approach, is this right for everyone, or is it only certain types of patients?
So it's rather you are your firstborn or you're 99 years old. It literally is for everyone. That's why I say it is for your traditional neck pain, back pain, but really neck pain, back pain is what we call an allogenic response. And that's just a fancy word for I'm touching, the neck, but, when I'm touching your neck, normally it shouldn't be painful. And if it is, that's kind of letting us know that that shouldn't be going on.
Right.
So even if you're kind of coming in just for wellness, which we love, or if you're coming in for a high-end athlete, I want to get, reaction time better. Or we have even some patients with wheelchairs, or older population coming in. because we also do stuff with movement disorders too.
Well, I know when I danced, I used to see my chiropractor all the time just for some hip things to increase my mobility. So it's really, like you mentioned, doesn't have to be coming in with an issue.
Right.
It can be very preventative in many ways. So talk to me about the consultation process and the best way if we have any questions.
So the consultation, like I said, everyone, we want to come in making sure we're doing a free 15-minute consult, making sure that we're going to be a good fit for each other. Because if we're both not on the same page, then unfortunately it's not going to work. So it's a free 15-minute consult to kind of get to know me more, to get to know kind of what's going on with you, and kind of seeing if we can help out essentially to go on for that.
Make sure you're the right fit.
Absolutely.
Absolutely. Okay. So is the best way to give you a call or go online to book that?
Online we have a website, brainspineconnection.com. We actually have Facebook, or you can call the office as well.
All right. Perfect.
Yep.
All right. Well, Dr. Walker, thanks for joining us and
you.
Educating us on this new approach that kind of mixes well with everything. And seems like you're really just trying to get to the heart of an issue.
Absolutely.
Perfect.
Absolutely.
Well, that's always a great approach. All right. So make sure you give him a call and book your free consultation to see if he can help you out in any way, whether it's an existing issue or you just want to make sure that you're taking the best care of yourself, right?
That's it.
All right. Dr. Walker, thanks so much.
Thank
We'll
you.
talk to you again soon.
Thank you.
And we'll be right back on Let's Chat.